So thank
Oh,
you for
no,
your
no,
time.
that's fine. No, 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 no. You're welcome. It worked out well.
Thank you. So I just wanted to start by introducing you. First and foremost, this is my aunt, Aunt Anne. She is a nurse. She is a registered nurse. She works at USC, correct?
Yes.
Awesome. And I would like to start out by just having her introduce herself. So, first question is, what is your nursing specialty?
I am an oncology nurse and I have branched out into a multi-specialty clinic. So I work with lots of other specialists, oncologists, um, hematology, oncology, and working in um, more specifically, but I cover a lot of territory now. So,
Wonderful. So you're
yeah.
very experienced.
Well, I've
Great.
been a nurse for 40 years.
So that leads to my next question. What was your educational path to becoming a nurse? What did that kind of look like in a brief summary?
Well, I didn't know I wanted to be a nurse exactly, but somebody said I'd either be a great nurse or a good teacher, and I think nursing has both. So, anyway, I pursued a degree in kinesiology, and my undergraduate degree was in kinesiology, and then from there, I was thinking about maybe working in medical sales, but so I kind of tiptoed a little bit in that direction, but then I decided I really wanted to go to nursing school. So I got my BS, my Bachelor of Science degree in kinesiology. Then I went to get my, decided on getting my BSN. So I went to get my BSN. And that's what I did.
Awesome. So you did it through Creighton, right? Your BSN,
Yes,
and
Creighton,
then your undergraduate through USC.
USC. Mhm.
Wonderful. Okay. So that comes to my next question. I think you answered, but how you've been a nurse, you said 40 years?
For, uh, for at least 40 years.
Wow, that's amazing.
Yeah, 40 years.
Congratulations. Um, so what motivated you to become a nurse? What was it in your life that you feel like made you decide, like, I want to be a nurse?
I just really believe that I love working with people, and I really was interested in the medical area, medical field. So my interest in medicine and healthcare, um, and being able to care for people at any stage of their life, um, and and people who were um, dealing with not just their illness, but how it affected their family members, how it affects the community at large, when people aren't healthy or they don't have access to healthcare. I just think helping people was a big factor in that. I just felt like that was the area that I was very strong in, and that's what led me to healthcare. But I always enjoyed medicine and um, learning about the human body um, and just it's just so vast that you could never not learn. And I always want to learn something. So I learn something every day and I'm still learning. And I
Amazing.
don't want to stop, and I don't think I will.
Aunt Anne for sure is for my teacher listening, she is one of the most patient, loving nurses you'll ever have. So I have so much respect for her. She's one of the reasons that I really want to become a nurse. So so kind of to segue into the next question, could you kind of describe your daily workflow? Like what is a day like? Because you used to work in a hospital, I know that. So the hospital setting was very different than what you
Oh,
currently work in now. But could you kind of explain the nuances, I guess, of your work now and like what a day might look like for you?
well, yes, I can do that. So I work in an ambulatory outpatient clinic. We have multiple, it's a multi-specialty clinic. So we have like maybe 70 different providers that practice there. And like I said, it runs the gamut from family medicine to dermatology, to various surgeons, oncology. We have an infusion center, it just is very, I mean, it's just we have a lot of practicing physicians and in our clinic. And so, but it's very integrative. And so anyway, uh, usually, well, I used to be more so. I would never know what my assignment would be. I would just, but then it was kind of narrowed down, and I ended up working with a few other, like a urologist and colorectal specialist. So over the course of the 14 years, almost 14 years since we opened the clinic, when I was hired for that position, I helped them set up the clinic and open the clinic. I was a group of a small group of people that was setting this massive clinic up. So, but I've worked in ophthalmology, and I've worked in a lot of areas. It's given me a chance to branch out and also utilize the skills that the fundamentals that I learned earlier in nursing, and just giving me an opportunity to utilize all the skills. You always use all the skills that you acquire at some point. It's very different than working in a hospital.
Yeah.
Yeah, the hospital, I enjoyed it um, a lot, and I never thought I would leave it, but I think it was just time for me to move on after 25 years of that, um, and move into a different setting. So the outpatient clinic setting was a good opportunity for me um, to make a change and to utilize more of my skills and my experiences from my earlier nursing career. Um, and it's very different. I manage a lot of patients. Um, and I mean, it's so variable. It's really hard to explain, but I manage my endocrine patients. I work for three really busy endocrinologists, and I do a lot of triage on the phone. They come into the clinic. We have clinic. The doctor sees them, and I work with the doctor closely on that. I give vaccines and injections of various types. I do procedures. People come in for blood pressure checks. People come in to have their ears flushed with that have wax in them, and so we do that. Um, there's just a lot of things that we do, but yeah, I do. One of the things that I never thought I would be doing is pre-authorizations for some of the medications that we need to give the patients.
Oh, wow.
So it's very hard because the authorizations take a lot of time, and I'm in the clinic a lot, so it's sometimes it's really difficult to
Yeah.
manage and balance all that. Um, and then I'm just if I'm needed, I'm called, and I go where they need me to help out. So in addition to my own assignments, so it's very variable. We do EKGs, we do pre-op. Screenings.
Yeah.
I've been not in this clinic I'm in now, but I was called to go to another clinic when I started. Well, a few years into the time I was in the clinic, but we had another clinic in another location, a smaller one. Um, I filled in for an LVN or a nurse that had to go on leave for 3 months. So I was in that clinic. I was the only RN, and I also had to draw blood. I had to room patients. I had to do procedures with I mean, I was one person, and I was running all over. And
Mhm. Yeah.
but yeah, some of the doctors. So drawing blood and rooming patients and doing procedures, doing EKGs. When I mean, sometimes you can get spread thin. So
Yeah. I would
if
imagine.
the staff support's not there. So, but
You do a
yeah,
lot of
so
different things. Yeah.
yeah,
That's
so you
great.
just do a lot of different things. Yeah, I mean, you sort of have to still take one thing at a time, but you have to sort of keep in mind, prioritize
Yeah.
and just keep moving sometimes. So yeah.
Well, awesome. That's amazing. I'm impressed by all you do. Um, Really quickly, could you tell me a story about, like a quick story about a difficult patient and how you handled it? Like, have you ever had someone that was really difficult and like what did you do to deal with that?
Oh yes, I've had, challenging patients before. sometimes, well, it's very variable, I guess is what I want to say, the scenarios. But yeah, I mean, I think sometimes people don't really understand like what you're doing on your side, and not that you expect them to, but some people demand a lot and they can't wait, or they don't want to wait, or they get impatient, and then they, you know, try to schedule an appointment. I mean, when you tell them you need to schedule your appointment when you're here, when you're here, or, before, uh, when you have your appointment, you should schedule your next appointment so
Right.
that you can get an appointment, and that you're not going to expect that you're going to get an appointment when you call, in a day or two or a week or something like that. So I think a lot of people get disappointed, but these um, specialists that I work with, they're booked up for months, and then people get upset that they can't
Yeah.
get in to see the doctor. Or, I mean, and I'm not saying if there's a real true emergency. I
Yeah.
mean, the doctor might take, call him back or figure, but I
Triage.
usually do that. I usually vet the calls, and I try to set it up so that I know exactly why the person's calling and what their needs are.
Yeah.
If I can take care of it, I will. If it's something that really does require more the doctor's attention, then I will let them know. But I think sometimes people just don't understand that, um, they want that, what they want it now. I don't know. It's just, a lot of things are so immediate, like with their phone, you just do this and it pops up. Well, it's different.
Yeah.
And we're, um, human beings, and all of us are. And I know sometimes people get, frustrated with the system of how to get an appointment or make an appointment or
Yeah.
what have you. But that's, I think, just trying to deal, people skills. I mean, it could
Yeah.
be service, it could be any type of service profession, but the health profession, sometimes people are, they don't have, I don't know, they don't want to wait, or they don't have
Yeah.
the patience to wait, or, they've had experiences that were not good, and they don't think that you're going to respond to them or something like that. So I think it's just people skills, trying to manage and help, people, and I think, reassure them that they will be they're being cared for, and that we'll, work through it. But I've had some people, like, I can count on one, not even one hand. I've had people who've gotten so irritated on the phone, they can't even explain. They try to explain what they need, and then you try to say, well, this is what I hear you saying, and you repeat it back to them because you want to make sure that, and they just, I don't know. I think that there's something that, is irritating to them, or they're having a bad day or something. So you can have not a good day as well.
Right.
So, you just have to try to diffuse people's, irritation and anger, and just remember sometimes we have our moments too. Not that we lash out or anything at people, but sometimes it just becomes a little overwhelming.
Yeah. Yeah. I mean, the
So,
kind of job you're doing, it's like it's stressful. So it can be like that
yeah.
from time
So
to time.
you just have to sort of temper the situation and diffuse people, and try to be of service, and help
Yeah.
them the very best that you can.
Yeah, that's awesome. So, I wanted to ask, what do you do for self-care? Like, what are the things outside of nursing that you do to help yourself be like good on the job?
Well, I think my faith is a big one. So I try to go to daily mass. And I try to, pray in the morning, and I try to exercise every morning early, so that I don't know, I try to pray, exercise. Um, I'm an early riser, and I always have been, but for as long as I can remember, I've gotten up pretty early in the morning.
Yeah.
So, so I
You're
think
very
I think that I
physical.
think that, and then I over the years, nursing is a hard. it's hard on you physically. The
Yeah.
hospital nursing is really, I mean, it's a very hard thing when you're helping to change beds and
Yeah.
change dressings and clean up patients and help them up and down to the bathroom or the bedside commode or whatever. But I mean, just rolling them over in bed and changing them and all the physical, it's a real physical job.
Yeah.
So I think it's important to take care of yourself and do things that you enjoy doing. But I definitely think that diet, exercise, and
Is a big part of that.
prayer are really helpful. So, and having a supportive family, is very helpful.
Yeah,
Um,
for sure.
yeah, so I think all of those things are helpful. But I also do acupuncture and once a week, and that's really helped me too. So,
Yeah.
um,
That's great. Those are really, it's important to take care of yourself because it's so demanding. So, my last two questions, and I guess they can coincide together, is what is your favorite part of your work? And what is your advice to future nurses?
oh, those are good questions. I I enjoy helping people, and whether it's my patients, their families, my doctors, my coworkers. I think that's what I love doing. I like to be of service and help people. Um, and it's not, I mean, it's all the patient, their families, and other people in our clinic, are my coworkers, um, my doctors, and I think that the interaction that I have, all the interactions that I have with all the different specialists and ancillary professionals is very important to me. So I would say that would be
That would be your thing. And then your advice for future nurses would just be, what would that be?
um, well, you're entering a really very humbling profession, and it's rigorous. It's rigorous.
Yeah.
But my advice would be get the best training you can, get the most experience you can, do whatever you can, um, and do it to the very best of your ability. There's always going to be someone who has, uh, been, in nursing a long time. And I think there's a lot of wisdom that people can share with a new nurse.
Yeah.
And so I think mentoring, having a wonderful mentor, um, I would say, but I honestly think is just get the best training, get the most experience, do whatever it is, even if you think, oh God, you shouldn't even think that because, making beds is important. Learning how to take care of a patient that's bedridden is, I mean, everything that you do, every task, every interaction with the patient is something that will make you a better nurse and that you do the best that you can. And I think when something goes not well, as things sometimes do, that I think that you need to reflect on those things and, you know, uh, I think process experiences. And anyway, I think, and for better or for worse, but I don't think anything is really bad, but sometimes there's situations or experiences that you have that are difficult. And I think having to reflect on them and process them and um, kind of go through them will help you in the future. Like they're a learning experience, stepping stones for what you could have done better. And
Yeah.
so I think that would be good. But I think also like reflecting on the end of your day, wherever you are, whatever you're doing, even if you're in nursing school or anyway, I think is important. And I also think your environment is very important. The,
Yeah.
the environment that you choose to work in.
Yeah.
That for me, it was important to work in an environment that, like, really the most important thing that coincided with my belief system and my values. And because I didn't want to put myself in a situation that would compromise that. And so I think
Yeah.
looking at that first and the places that maybe I applied for a job, that was important to me that their values and their philosophy were in line with mine in terms of my um, personal belief system, and that was important to me. So I think that I would consider all of that because I think when you start working, you have a choice of where you'd like to apply, and I think that your environment can definitely impact. It can make or break you, and the environment, the nurses and the other people that you're working with, can make a huge. It can make a big difference. Like sometimes almost all the difference. So you want people that are hard workers, that are well trained, have good
Yeah.
education and experience, and who like to share their wisdom with you
Yeah, and their perspective. Yeah,
and
yeah.
their knowledge, because it's really important. So you want a very um, just you want a very reputable place to work.
Yeah.
So just like they're looking for people to employ, you want to make sure that that you have um, your ideas, like your priorities, right? So
Yeah.
that they match up with maybe that they match up with your potential employers. And yeah, and training and certification, those are all important things. I mean, for yourself, but for the people that are working with you, people who might be training you. So that's important too.
Well, awesome. Thank you so much. I really appreciate your
You did a
time.
good job.
Thank you.
I'm
Thank you,
glad.
Anne. No, I really appreciate you. And yeah, I thank you for doing this interview and have a great rest of your day. Thank you. Oh, wait.
Yeah.